Good afternoon. Today is March 25th, 2020. Today's community update on COVID-19 response in Buncombe County is being streamed live here on Buncombe County Government's Facebook page, and a Spanish language version of this media update, community update, will be aired on the Buncombe County Health and Human Services Facebook page, and that Facebook handle is @BCHHS. Today's updates come from Dr. Jennifer Mullendor, the Buncombe County Interim Public Health Director and Medical Director, Fletcher Tove, Buncombe County Health and Human Services Public Health Preparedness Director, Brownie Newman, Chair of the Buncombe County Board of Commissioners, Esther Manheimer, Mayor of the City of Asheville, and Tim Love, Buncombe County Intergovernmental Affairs Director. I'm Stacy Wood. I'm the Health and Human Services Public Information Officer. Today's first update comes from Dr. Mullendor.
Good afternoon. As of this time, we have been notified of a total of 13 cases of COVID-19 in Buncombe County residents and 5 cases in out-of-state travelers to our county. 10 of the Buncombe County residents who were found to be sick with COVID-19 have already recovered from their illness and have been released from isolation by Buncombe County Public Health. Additionally, all of the out-of-state travelers who remain in our county have recovered from their illness and have been released from isolation. Buncombe County Health and Human Services communicable disease staff have conducted 14 tests for COVID-19 since the start of the outbreak. 13 of the 14 test results have returned at this time. So far, only 1 of those tests has come back positive for COVID-19. With regard to the specimens collected at last week's Buncombe County community testing sites, results from the 256 tests conducted during the first 2 days have returned. 5 of those tests came back positive. Results from just over 100 specimens collected on the final day of the Buncombe County community testing site are still pending at this time, but are expected to return shortly. Over 700 tests have been conducted by other Buncombe County healthcare providers since the start of the outbreak. Buncombe County Public Health is notified of all positive test results for COVID-19 in Buncombe County residents and travelers temporarily residing in our county. Our nursing staff contact the individuals to inform them of their results and provide appropriate guidance. I want to direct everyone to our buncombecounty.org website and a handout that is posted on the page. This handout comes from North Carolina Department of Health and Human Services and covers a lot of information and answers a lot of questions that we've been receiving from the public about what should you do if you have symptoms of COVID-19, who is most at high risk, when should somebody call their doctor or 911, how they should isolate themselves if they have symptoms of COVID-19, and when they can return to their normal activities, and also what should family members do. So I would encourage everybody to go to buncombecounty.org and review the information on this flyer. I'll now turn it over to Fletcher Tove.
Good afternoon. I'm Fletcher Tove, Buncombe County Public Health Emergency Preparedness Director. So yesterday we spoke about how we are drafting a supplemental declaration to our local state of emergency. We have completed those drafts, and we will have Chairman Newman up shortly to sign into effect that declaration. But first, I want to take some time to speak to the declaration, hit some of the highlights, And then I'm going to turn and go through a interpretive guidance document that is going to be released to accompany the declaration to help the general public determine what is essential or non-essential traffic, what is essential or non-essential business. So to start off with our supplemental declaration, and again, I'm just going to go through the highlights of this. It's much more detailed than I'll be addressing at this point in time, but this is being pushed to our media partners and will shortly be available on buncombecounty.org. To start, this order takes effect at 8 p.m. on Thursday, March 26, 2020. That's tomorrow at 8 p.m. And will continue through 6 a.m. on Thursday, April 9th, 2020. To start with the declaration, all individuals currently living in Buncombe County are ordered to stay in place at their place of residence. All persons may leave their residence only for essential activities or to provide or perform essential government functions or to operate essential businesses. And in a moment, we'll speak about what those are. All businesses operating within Buncombe County, except essential businesses that we'll define in a moment, are required to cease all activities at facilities located within the county. To clarify, businesses may continue operations if they're exclusively employees and contractors performing those activities at their own residences, working from home. And to the greatest extent possible, if you are an essential business, you must still comply with social distancing guidelines, maintaining 6 feet for both employees and general public. All public gatherings and private gatherings of any number of people occurring outside of a single household or living unit are prohibited for the duration of this declaration. Restaurants with or without drive-in or drive-through services, to include microbreweries and distilleries, may only provide takeout, delivery, and drive-through services. Religious worship services may be only provided by video and teleconference for the duration of this declaration. Religious institutions must limit in-person staff to 10 people or less when preparing for and conducting these video and teleconference services. All visitors traveling to Buncombe County from areas experiencing community transmission of COVID-19, notably New York State, Washington State, and California, must self-quarantine at their residence upon arrival for 14 days before entering the community. All elective medical, surgical, and dental procedures are prohibited in Buncombe County. Now I'm going to speak a little bit about what defines essential and non-essential activities in essential and non-essential business. So when we're talking about essential activities, I'm going to put that in some broad categories for the time being, and there's more detail in the declaration itself. But individuals may leave their residence to perform these following essential activities: for health and safety, for necessary supplies and services, for outdoor activity, for work deemed essential, and to take care of others. And we'll go into some more clarification on that momentarily. For the purposes of this declaration, essential business is defined as follows. And again, I'm going to give broad categories here, and we'll provide further guidance through the interpretation document. Essential healthcare operations, essential government functions, essential critical infrastructure, essential retail, educational institutions facilitating distance learning, providers of basic necessities to economically disadvantaged populations. Essential services necessary to maintain essential operations of residences or other essential businesses. The news media. Child care services. And a point I like to bring up is that all businesses may maintain a level of minimum basic operations. That's that employees must comply with social distancing requirements to the greatest extent feasible while carrying out these minimum basic operations. But these are activities to maintain the values of a business's inventory, preserve the condition of a business's physical plant and equipment, to ensure security, process payroll and employee benefits, or other related functions. They may also facilitate employees of a business as minimum basically as possible to go into a business to enable remote work for other employees at their residence. For example, one employee may go to the office to do administrative work so that others may continue to work remotely. Any manufacturer who retools so that a substantial part of their business is for the purpose of manufacturing and producing ventilators, personal protective equipment, or another good supporting medical response, such as sanitizers and disinfectants, is considered an essential business under this declaration. This declaration also suspends all delivery hour restrictions and transport restrictions to and from any entity involved in the selling and distribution of food products, medicine, and medical supplies in Buncombe County for the next 60 days. If someone in a household has tested positive for COVID-19 or has signs or symptoms consistent with COVID-19, they are instructed to self-isolate at home. Other occupants of that household are ordered to quarantine at home, following guidance from public health. Elderly persons and those deemed at high risk of severe illness from COVID-19 are urged to stay in their residences to the greatest extent possible. Long-term care settings, including but not limited to skilled nursing facilities, adult care homes, family care homes, and assisted living facilities, are instructed by this declaration to prohibit non-essential visitors from accessing their facilities unless to provide critical assistance or for end-of-life visitations. All lodging facilities, including campgrounds with rentals or leases for less than 1 month in duration, shall be closed except for the work-related accommodations, facilities housing persons experiencing homelessness, or any facility being used for isolation and quarantine purposes. Current residents at hotels, motels, bed and breakfasts, and campgrounds and other short-term rentals are permitted to stay, but these facilities should cancel any leisure travel reservations for the duration of this declaration, except for employees who are working for businesses or organizations deemed essential to community response. As I said, an interpretive document has been developed and accompanies this declaration, and I'll get to that in a moment. And failure to comply with this declaration is a Class 2 misdemeanor. And again, this declaration goes into effect tomorrow, Thursday, March 26th at 8 p.m. and will continue through Thursday, April 9th at 6 a.m. Now moving on to our interpretive guidance. So the intent of this declaration is to further minimize all opportunities for exposure and transmission of COVID-19 across the jurisdiction. This campaign and declaration are stay home, stay safe. And the intent is to limit movements outside of homes that are not deemed essential. This declaration will be reviewed and evaluated daily, which may lead to revision, amendment, or extension. So let me talk a little bit about what Buncombe County residents can do. You can go to the grocery store and the convenience store. You can go to the pharmacy to pick up medications and healthcare necessities. You can visit a healthcare facility for medical services that cannot be provided virtually, and we encourage you to call first before going in for those services. You can go to restaurants for takeout and use them for delivery and drive-through service. You can care for and support a friend, a family member, a neighbor's pet. You can go outside to walk, ride your bike, hike, and jog, as long as you're observing the social distancing measures. You can walk your pets and take them to the vet. You can help others get necessary supplies, and you can receive deliveries from any business that delivers. What Buncombe County residents should not be doing: you should not go out at all if you are sick. You should not go to work unless you are providing essential services as defined by this declaration in support of an essential business. You should not visit family and friends if there is no specific and urgent need. You should not be closer than 6 feet to others if out in public. You should not visit loved ones in the hospital, nursing home, skilled nursing facilities, or other residential care facilities, except for limited exceptions as provided by that specific facility. You should limit travel except for essential travel and activities. And you should not engage in door-to-door solicitation. Activities that are considered essential. Again, these are some broad categories with more detail in both the declaration and interpretive guidance. But those categories are, again, health and safety, to get necessary supplies and services, for outdoor activities, for work and essential business and operations, and to take care of others. Now I'll get into some frequently asked questions that we're already seeing, try to clarify some of this declaration. So what is the difference between stay home, stay safe, and shelter in place? So in a stay home declaration, residents can still perform essential services and conduct essential travel. We've seen many jurisdictions across the country order shelter-in-place declarations. And frankly speaking, I think those declarations were a little erroneous in their use of that term. Shelter-in-place only permits emergency travel and emergency services, so it is fundamentally more restrictive than a stay-at-home order. Buncombe County is not currently planning to enact a shelter-in-place order. If I live outside of Buncombe County, how does this affect me? If you work in Buncombe County, then your business and employer must comply with this order. You are allowed to travel through Buncombe County and conduct essential activities within Buncombe County and then return home. What's considered essential travel? Any travel related to the provision of or access to essential activities, essential government functions, essential business and operations. Travel to care for elderly, minors, dependents, and persons with disabilities. Travel to or from educational institutions for the purpose of receiving materials for distance learning, receiving meals, and other related services. Travel to return to a place of residence from outside the jurisdiction. Travel required by law enforcement or court order. Travel required for non-residents to return to their place of residence outside the county. Am I allowed to go outside to exercise? Yes, that's encouraged, but maintain social distancing. Do not be in gatherings of people and maintain at least 6 feet from others. Discussing enforcement activities. Can I get arrested for violating this order? All Buncombe County law enforcement entities will enforce this order through education, dialogue, and seeking voluntary cooperation from all restaurants and businesses. If voluntary cooperation is not achieved, Buncombe County law enforcement is equipped to enforce these restrictions through citations and misdemeanor charges. Any person violating any prohibition or restriction imposed by this declaration can be found guilty of a Class 2 misdemeanor. How do I report violations of this order? We ask that you report violations to the local jurisdiction law enforcement agency via a non-emergency line. We don't want people calling 911 to report these violations. Please use a non-emergency line. I live in Woodfin, Black Mountain, Weaverville, Biltmore Forest, Montreat, or City of Asheville. Does this order apply to me? Yes, this order applies to all residents of Buncombe County across the entire jurisdiction. Does this order apply to the homeless? No. Homeless are exempt from these restrictions, but are urged to find shelter, and we are working with community partners to provide resources and opportunities for them. Some guidance on essential businesses. So that if you're deemed an essential business through the details of this declaration, you still must continue to comply with guidance and directives for maintaining a clean and safe work environment to include social distancing and sanitation practices. And again, those essential businesses, the broad categories are essential healthcare operations, essential infrastructure, essential manufacturing, essential retail, essential services, news media, financial institutions, providers of basic necessities to economically challenged communities, construction, defense, and basic government functions. I also want to take a moment, once you receive this guidance in this declaration and you find that your business is not deemed to be essential and you believe it should be, we have a process to request exemption. We need you to send an email to business@buncombecounty.org. In this email, provide your business name, the best point of contact, email address, phone number, and a statement as to the nature of your business and why you should be deemed essential. And if you have a website address, please include that. Please be aware that this is a new process and the county is already receiving an extremely high number of emails and any response may be delayed. Requests by businesses to be designated as an essential function as described above should only be made if you are not already covered by the guidance. So if you're in a category of an essential business through the declaration and the interpretive guidance, you do not need to apply for essential status. You're already covered. And on the final note, this declaration, do not use it as an excuse to make a run on grocery stores and convenience stores and conduct panic buyouts. We talked about this yesterday, but essentially what you do when you do that, in a sense, is you're taking from families and individuals who may not have the means to buy ahead, families and individuals who may not have the schedule to support getting to the store in time to keep up with these panic buyouts. So please be reasonable with your purchases at the grocery stores. With that, I turn it over to Chairman Newman for remarks and signing of the Supplemental Declaration.
Thank you, Fletcher. Good afternoon. My name is Brownie Newman. I'm the chairman of the Buncombe County Commission. I would like to acknowledge some of the other elected officials that are here today. I don't believe they're on the screen, but I'd like to acknowledge those who are with us, including County Commissioners Amanda Edwards, Anthony Penland, Joe Belcher, as well as our mayor of the city of Asheville, Esther Mannheimer, and Sheriff Quentin Miller. Buncombe County is today taking additional steps to slow the transmission of COVID-19 in our community. By enacting the Stay Safe, Stay Home emergency declaration, we are implementing a proven and effective strategy for slowing the spread of COVID-19. Communities around the country and around the world that have taken steps to implement effective social distancing have seen slower rates of transmission, especially when these steps were taken while overall levels of COVID-19 were still relatively low. We appreciate that many businesses, organizations, and families have already taken steps to practice social distancing by, for example, having their employees work from home are holding their church services online for the time being. As our local health officials have said, the next 2 weeks are a critical period in the effort to slow the spread of COVID-19. A key goal is to limit the number of individuals who get sick and the number who require intensive medical care at a lower level so that we do not exceed the capacity of our local medical facilities and hospital. We want to assure that all people who need medical care will be able to receive it, and we can only do that if the numbers of people who are sick at any one time does not exceed the capacity of our local medical facilities. We do not take the decision to issue the stay home, stay safe order lightly. We understand these measures cause more than just inconvenience for many local businesses, workers, and families. However, the steps that we take now mean that our community will get through this challenging time in better shape. During this 2-week period, we will be evaluating strategies that can enable more businesses and organizations to safely begin resuming some operations as we go forward and make progress on this challenging health issue. I want to emphasize that while the intent of this order is to encourage everyone to stay home and stay safe, this does not mean that individuals cannot move about the community to care for family members, neighbors, and vulnerable members of the community. This is a time that we all need to be looking out for one another. Please do so in a way that is as safe as possible and minimizes any unnecessary close contact. Many businesses and organizations will have many questions about how this local order affects their operations. I encourage everyone to please read the order and itself and the supplemental guidelines. These documents will answer most of your questions. So I would now like to go ahead and sign the order. Buncombe County has been closely coordinating all of our efforts in response to COVID-19 with all the municipalities in Buncombe County. I would now like to invite Esther Mannheimer, the mayor of Asheville, to come forward and share a few remarks. Thank you.
Good afternoon. My name is Esther Mannheimer, and I'm mayor of the city of Asheville. As mayor of the city of Asheville, I want to express my gratitude to all those who are practicing social distancing and following the public health guidelines during this pandemic. Today, we are joining with the county in enacting further measures to close all non-essential services so that most of us can stay home. I encourage all residents to take these measures very seriously. We need to be successful in flattening the curve by staying home. As the chairman mentioned, flattening the curve will help us not overwhelm our hospitals and our healthcare workers. It will help us keep the elderly residents and vulnerable populations, including folks with chronic diseases and pregnant women, safer. So please, hunker down and practice social distancing. If you're sick, stay home. Flatten the curve, helping to ensure everyone who gets sick gets the care they'll need. To say these efforts have caused great economic hardship is an incredible understatement. I am hopeful that the sweeping aid package being considered by Congress as we speak will immediately provide substantial relief needed by so many individuals, especially those who have lost their job right here in Asheville and Buncombe County. At last night's City Council meeting, we voted to move ahead with participating in the One Buncombe Fund, a partnership with Buncombe County, other municipalities, and corporate and individual donors to help small businesses and individuals who have lost their jobs. The One Buncombe Fund will provide immediate assistance supporting both individuals and business community members in Buncombe County. At a later council meeting, we will allocate such funds. And shortly, you will be able to find out information about this assistance on the Buncombe County COVID-19 website. I would like to thank several folks, including Avril Pender, the county manager who is here today, all the county health department staff, the chairman, Brownie Newman, who just spoke, the county commission itself, and the City of Asheville manager, Deborah Campbell, who is also here, as well as the City of Asheville employees, all of whom continue to provide services to our community. And I want to highlight how fortunate we are to benefit from the incredible collaboration among the various governing agencies here in Buncombe County through the Emergency Operations Center, which works to coordinate emergency response efforts. I want to thank the EOC for its work. Again, help support the health of your community by following the requirements of the Stay at Home, Stay Safe Emergency Declaration. Thank you. And now I want to introduce Tim Love, Buncombe County's Intergovernmental Affairs Director.
Good afternoon, Tim Love, Buncombe County. This afternoon I'm going to speak to you about the One Buncombe Fund, which Esther Mannheimer has spoken to you briefly about. One Buncombe is a response to a critical need in this community. We know many people have been impacted at an individual level and at the small business level. And so we're responding timely in order to make sure that we're filling the gaps and providing support for those folks that need it. So what is One Buncombe? One Buncombe is a partnership. It includes many of our local governments, our private sector, our corporate entities, and many of our community partners. Additionally, One Buncombe is a donation center. We're reaching out to individuals in the community, folks like yourself watching at home. We're reaching out to corporate entities, businesses in our community, and we're reaching out to our local foundations to give financially because people need it. One Buncombe is also a relief center. We are targeting individuals that have lost employment due to COVID-19, as well as small businesses, businesses under 50 employees that have been impacted by COVID-19. How will One Buncombe work? On Friday, we will have a press release when we will launch more information about the program. During our Friday media release here, we'll talk about the website where folks like you will be able to go and donate financially to the One Buncombe Fund. With those funds in hand, a community board will make decisions on the allocation of that funding. And we hope to make that funding available as soon as possible. The timeline on this will be described on Friday. Our local partners will make available funding in mid-April, but we hope to have additional funding available earlier due to our relationship with our community development financial institutions. One Buncombe is a great opportunity to support one another, and I'd like to leave you with one quick note. Buncombe County is strong and resilient. When times are hard, we look out for those with less, and we pool our resources to make sure other neighbors are getting by. Even though we are apart, we can come together as One Buncombe. Thank you.
This concludes our community update. We are continuing to adapt to a more virtual environment, and we appreciate your patience and understanding as we continue to provide relevant and accurate information to our community. We encourage everyone, as usual, to get factual information on COVID-19. The CDC and the state North Carolina Department of Health and Human Services website is a great resource. And as always, during these media updates, community updates, we encourage folks to visit buncombecounty.org for specific information on the COVID-19 response in Buncombe County.